welcome back. This is Healthy and Wise, and we're going to be doing this from 8 a.m. to 9 a.m. right here on Alpha Jiri, only on K24. You know, this is what we do on Tuesdays, and as always, we are looking for your feedback. And if you have any questions, as always, our social media platforms are live and active at K24 TV on Instagram, Facebook, and Twitter. My name is Shiko Kaitani, and today we do have a good one for you because it's something that we can all relate to in some way or another, and that is all about your posture. Now, it is so important to develop a good posture, and you're going to be finding out why. And so here today, we're going to be welcoming back for a second time Polycare Medical Center. Jackie Mweni is the lead clinical massage therapist, and she will be telling us about how to correct our posture. And by the way, when we talk about correcting your posture, in everyday activities, what is the right way to actually position your body? And after that, we are going to be talking about a few techniques that you can even use right at home in order to relieve that chronic pain that you're probably feeling in different parts of your body. Jackie, welcome to the show.
Thank you, Shiko.
So glad to have Polycare back. And this time around, we are talking about posture. Last time we did have Delizo Nicholas here on the show telling us a little bit about Polycare. Yes. Today, now we actually want to understand about some of the services that Polycare actually offers. Okay. But let me engage you just as we're getting an introduction, a feel into this topic, Jackie, about the difference between what we all see at your regular spa, yes, which is like a wellness massage, versus what you do as a clinical therapist.
Okay. First of all, I'll begin by describing clinical massage. Yeah. So this is a specialized kind of treatment that is aimed at managing chronic pain. Yeah. And the difference between clinical massage and wellness massage is, first of all, in the intention of the massage, the setup, and the number of treatments. So for clinical massage, the setup is normally in a clinical setting, and it's normally directed by either the referring doctor or the physical therapist. Then a wellness massage on the other end, it's normally in a relaxing environment, usually in a spa. Yeah. So the other difference between a clinical massage and a wellness massage is in the intention. Right. So for clinical massage, the intention is normally to solve a particular problem, normally after a medical diagnosis. Okay. For a wellness massage, on the other end, you do not need to have any medical diagnosis. You can just walk into a spa and relax. Right. So for wellness massage, the intention is normally relaxation, stress relief. And another important aspect to note about clinical massage is the number of sessions. We have a treatment plan programmed. Oh, okay. With a number of consecutive sessions. Yeah. And after, we normally give a care plan to the patient to maintain these results. But in a wellness kind of massage, we do not need a treatment plan, and we do not have a limitation as to the number of sessions that the patient or the client needs. Yeah,
because it's just a feel-good session. It's just for you to go and relax yourself. Okay, we want you to actually paint a picture for us today. What do you typically deal with from day to day? What are the cases that come in when someone says, I've got chronic pain? What are you looking at?
First of all, I'll begin by saying that when people present with medical conditions at the clinic, they normally go to the doctor first or the physical therapist before they're referred to the clinical massage therapist, because we do not diagnose. So some of the major problems we deal with are, first of all, chronic low back pain. That's a huge one. We have tension headaches or migraines. We have sciatica, which is pain that radiates along the path of the sciatic nerve. So through the chart here, I'll illustrate where the sciatic nerve passes through. So it starts from the low back to this area, to the back of the thigh, to the back of the leg, until the foot. So what happens is, because of a trauma to the low back or muscle tension along these areas, it could pinch on the nerve fibers. And so you tend to get symptoms like shooting pain, tingling pain, or numbness that shoots to the leg. Oh, right. Yes. Okay. Another condition we deal with is repetitive motion injuries. Okay. I'll explain that. So when, for example, when someone is typing in a desk, they're doing this constantly. Right. So they're using these extensor muscles of their arm, and they are normally shortening all the time.
Yeah.
So as they shorten, they could pinch on the nerves on the wrist, and they cause that throbbing pain that's normally tingling and burning.
Right.
And then there's also another condition that we deal with majorly, which are disc problems.
Okay, so a slipped disc.
Yes,
okay.
slipped disc. So I'll just explain.
Yeah.
So this is the vertebral column,
and
it has the bones.
Yeah.
Sorry.
Oops. Yeah, go ahead.
Yeah. So we have this bones here that normally divide the vertebral column.
Right.
So in between the bones.
Yes.
I'll just stand up. In between these bones, we have rubber-like discs, which normally act as shock absorbers. So inside this rubber-like disc, we have some jelly-like substance, which is enclosed in a hard casing.
Right.
So what happens is, because of trauma, like forward bending, this is actually a very important thing. When you bend forward and you lift something heavy, you could cause that disc slip.
Oh, wow.
Yeah. So the disc slip, normally the jelly-like substance normally seeps outside, and it could pinch on the nerve fibers.
Okay.
So that's what causes, hence the pain. So that's what causes the throbbing, the pain, the burning sensation, and the tingling sensation.
Okay.
Yeah.
Okay. All right. You know, when we actually talk about posture a little bit, I hope that balance is right. When we talk about posture, a lot of people would probably say, what's so important about actually aligning my body in a particular way, or sitting upright or standing upright in a certain way? Why is posture and getting a good posture at that so important, and how does that translate to chronic pain?
Well, maintaining a good posture is important because, first of all, posture is aligning your body with the correct amount of muscle tension. So when you do not sit, stand, or walk in a proper posture, you're placing unnecessary pressure on the muscles or the joints. So you end up having imbalances in your body.
Right.
So how this translates to pain is, for example, when you're sitting hunched in a desk like this, you end up, these muscles are tightening, the chest muscles are tightening.
Right.
So they'll end up forming painful nodules, and eventually you'll be having chronic low back pain.
Right.
Another perfect example is how we look at our gadgets. With the forward head posture. So we are normally like this, staring at our phones.
Right.
So putting the head down is putting a lot of pressure on the neck and the vertebral column. So with time, it causes disc degeneration. So the thing with posture is that you're not going to feel the effect overnight. It's a gradual process. So when you don't look out for it, you degenerate slowly. And another very important aspect, like I mentioned before, is the forward bending. That is the most dangerous posture that you can have, because when you bend and lift a heavy object, you're putting pressure directly on the spine.
Can you continue to at least elaborate a little bit more in terms of everyday activities where poor posture actually presents itself? You've actually talked about how we look at our gadgets.
Exactly.
That is so important. I would have never thought of that. The way you actually stare at your phone and you're busy, you know, here doing your thing.
Exactly.
You've talked a little bit about how we are at our desk.
Yes.
So where else do you actually see, and you can spot it out, because as a therapist, you'll be walking and seeing, okay, that's,
Yes. When we are carrying heavy handbags.
Okay.
Or heavy
really?
or sling bags. So usually when your handbag is heavy on one side, you'll tend to lean more on that side. So that's already causing structural imbalance. So what you need to do is you need to keep on changing sides, or just put the bag across such that the weight is balanced within the body, or evenly distributed. Yes.
Okay, good point. My director is like, Shiko, how you're seated, is that good posture? And I'm like, oh, okay. Talk a little bit about how we sit.
First of all, catch yourself seated in the wrong position.
I'm like, so Jackie, tell me. Anyway.
For me, what works for me, because we cannot be perfect, you know, so we just practice mindfulness, and just being aware. So catch yourself seated in the wrong position and just correct it. And because we are creatures of habit, when you do it continuously, it becomes like part of you. Like the way you look at your phone, I used to do that. Then when I learned that you have to put your phone this way and support your hand. It became, I always catch myself like, oops, I need to do this. So with time, it becomes a habit.
Yeah. Okay, one of the frequently asked questions that came through when we were actually researching for this show that, you know, a few individuals told me to ask you was in regards to even our weight. Why is it that people who are probably either plus size or overweight tend to feel a lot of pain on their joints and have chronic pain, and, you know, walking is an issue for them, climbing upstairs is almost impossible for them? Yeah.
That's because the body structures are normally designed to be balanced and to carry particular amount of weight. So when your upper body is heavier than your lower body, then it's placing a lot of weight on your hips and your knees. So that's why we have a lot of people who have a lot of weight on the upper body suffering from arthritis of the knees. So it's just basically a balance of the body structures.
Okay. One of the biggest culprits, high heels.
Exactly. So I was actually going to mention high heels as one of the ways in which we don't choose correct posture. So constantly wearing high heels normally puts your foot in a plantar flex position. I'll explain that. Your foot is in this position mostly. So it's putting pressure on the lower leg. It's putting pressure on this ankle joint here. So it's very important that you interrupt. You like do in between. You remove the heels. You put on flat shoes. Or you could put your heel on the stair, on the edge of the stair, just to straighten your leg in between long periods of wearing high heels. And it also affects your low back because you're hunched in this position most of the time.
So you always tell ladies, try to avoid, especially the super high.
Just avoid, or if you can't, you just alternate, like sometimes, and stretch your foot.
Okay. For those who actually go to the gym quite a bit, very active, tend to actually have a lot of joint pains. Anything in regards to perhaps, you know, the exercise, you know, contributing to their chronic pain?
Yes, absolutely. First of all, body dynamics. You have to go to a certified trainer. Because if you're doing the wrong exercises, you're placing unnecessary pressure on your body, or you're doing too much, especially for weightlifters. You're lifting weights incorrectly, then you're damaging your body in the long term. And then we also have those sudden traumas. Like we have people coming into our clinic and they're literally, they can't walk. They just snapped the back at the gym because they probably just went and lifted a very heavy weight that they had not programmed their bodies to do. So if you're in any fitness kind of program, just do it one day at a time.
Okay. Very, very, very important note there. You know, because people tend to just go to the gym, feel that they can self-train. And these days, even a lot of gyms are marketing that it's okay, you can come, use the machinery, use whatever you want, but without any supervision. And before you know it, Polycare now has clients, and that's a good thing though.
No, we don't want them to suffer. So
all right, so then that actually brings us to the next question in regards to what good posture is. Jackie, what then would you define as proper posture that is recommended?
Okay, first of all, proper posture is making sure your body is aligned to the correct muscle tension. So for instance, if I'm sitting, I have to make sure that my shoulders are relaxed and my spine is in the neutral position. So one of the easiest ways to do that is to make sure that the distance between the edge of the seat and the back of the knee is as short as possible. So let's just do that practically. So if so your back goes straight automatically. It's not hunched and you're not slouching. So you just make sure your shoulders are relaxed and your head is in a neutral position. As simple as that. And then you just put the feet a bit apart. Just a bit. And then flat. It's good for them to be flat. Basically that.
We talked a little bit about lifestyle changes, even the things that we can do around us to change our environment to make it more, let me say at least helpful towards helping our posture and caring for our bodies. And you were very passionate about that. For example, some of the items that we use, the chairs that we use, you know, the shoes that we wear. some of these changes, do you even talk to clients about that?
Yes, we do. Yeah. Like I mentioned, we normally have an aftercare advice that we normally give to clients because ours is a non-invasive kind of therapy. So we allow the body to heal itself. But if you come in and we treat you and you still continue sitting in the wrong posture, walking in the wrong posture, you will not maintain that. So we give you stretches, we give you strengthening exercises, and we give you ways that you can correct your posture.
Right, right. So even going back to some of the things that we need to change, look at the way we have perhaps even office setups with chairs that are not ideal. When you think about, like, I use the example of shoes because this is very important, especially when it comes to women. You buying particular shoes that aren't really ideal for you if you're having pain.
Like flat shoes are not good for the low back, like totally flat. And then very high heeled. You can just put on a slight heel or a wedge. Yeah, that puts the back in a neutral position, the curvature of the low back in a neutral position.
Okay. Yes. All right. So we're going to ask you to send in your questions if you've got any suggestions perhaps as well that you would like us to incorporate in this particular discussion. Why don't you let us know through our social media platforms at K24 TV on Instagram, Facebook, and Twitter. I hope you're already sitting up straight because now I'm feeling kind of
conscious
about it. I'm like, do I have the perfect posture? We will be looking out for your feedback right here on the show. But talking a little bit about the risks involved for the poor posture positions that people have. Yes, we've talked about chronic pain. What else are people at risk of if, we continue to practice or present poor posture?
Another issue is trauma to the spine. With age, our spinal discs normally degenerate. But then when we are constantly in the wrong posture, we normally hasten that process. For instance, lifting heavy objects when you're forward bending, that is very risky because you could snap your back suddenly.
Wow. Yeah, something as simple as that.
Simple as that, yeah. So that's a very important aspect. And also, even just the forward head posture, with time it causes degeneration from the neck going downwards. And then also, poor posture normally causes low energy levels, chronic fatigue.
Exactly. I did even see that a little bit in terms of one of the articles I came across, how posture is linked to mental health issues.
Absolutely.
And so do people generally feel just overwhelmed, like the way you said, constantly fatigued, and it's simply just because of their posture, of how they've aligned their body?
Exactly. And then posture also has a very direct relation to our moods.
Right.
So when your mood is low and you're having negative feelings, then automatically you're having negative thoughts and depressing thoughts. So that's a direct link to mental health or even stress. Because when you're in the poor posture, you're putting unnecessary stress on your body structures, and eventually then that affects your mind.
And it's interesting because remember, whenever they're trying to build your confidence, they always tell you head up high, shoulders back, because there is a direct correlation to how you're going to feel about yourself when you apply a good posture. Okay. All right. So that being said, we're going to take a short commercial break. Jackie is still here in studio if you've got any questions. And after, once we get back, we're actually going to be talking about some of the simple massage therapy techniques that you can apply at home in the workplace just to help with that chronic pain or just that pain that you might be feeling at any, particular part of your body. So why don't you keep it K24? And of course, we'll be right back in just a moment.